Friends, this is a case of TLH in previous two Lscs. We have injected vasopressin, 2 ampules in 400 ml normal saline, and given 6 units of vasopressin. Uh, we are coagulating the broad ligament. Vasopressin will help in separation of urinary bladder from the cervix at the scar site, because it will decrease bleeding and it will make the planes more visible. So this is a densely plastered scar. Do not go very close to the uterus. Stay a little bit away from the uterus so that you have something to coagulate in case of bleeding. Now we will coagulate and cut the posterior layer of broad ligament. Take small bites and take thinned out peritoneum, because here lies the posterior uterine vein. Sorry, uterine vein, not posterior. It lies the uterine vein, and if accidentally injured, it causes severe bleeding and disturbs you throughout the surgery. We will go from one round uterosacral ligament to another uterosacral ligament here. Now we are coming to the separation of bladder. Only trick is to stay very close to the cervix, and there should be no yellow with the uterus. All yellow goes with the bladder. You have to give good traction and counter traction to separate the bladder. And second thing is, if there is bleeding, don't unnecessarily keep on coagulating the bleeder. Just put a gauze piece. These bleeders are weak bleeders and they stop by the pressure of a gauze piece. And by the time you finish your surgery, the bleeding has already stopped. And if you keep on coagulating the bleeder, you will end up with a bladder injury. Another trick of bladder separation is you can go to the uterine vessels and you should remain above the uterine vessels, because bladder is above the uterine vessels. And thirdly, if still in doubt, you can fill the bladder and you will know the boundaries of the bladder, and then you can separate the bladder. The bladder is densely adherent. Now, the cervix has come. You identify cervix by the parallel blood vessels over its surface. Separate the bladder enough so that while coagulating the uterine arteries, you don't injure the bladder. You don't do any thermal damage to the bladder. Now we are defining the uterine arteries. Now you have entered the cervical The only thing that I have realized is dissect as much from the left side as possible and do the rest of the dissection from the right side. The right side will take then around few minutes to complete it because most of the work you have done from the left side. We have to learn to use harmonic in the left hand. Most of the dissection of the right side we have done from the left side. Now we are cutting the right broad ligament. separating the rest of the urinary bladder. After separating coagulating and dividing the uterine pedicle, now the uterus is free from vault. We will check hemostasis, suture the vault, take 2 sutures, very good bites on the right edge and the left edge for better hemostasis. Thank you.